Hello everyone. I myself is Dr. Ashis Datta. I'm a consultant neurologist and in charge Epilepsy and Electrophysiology Division in Institute of Neurosciences, Kolkata. Today, I will talk about one of the important aspects of epilepsy, which is many of the times actually overlooked or not that way overemphasized. That is quality of life issues in epilepsy. As we know, epilepsy is one of the common neurological disorder in the society, and 80 to 85% of the world populations with epilepsy live in the developing countries. And if we talk about the prevalence in India, it's about 5.1% in urban and about 5% in rural areas. Now, epilepsy can be associated with profound physical, psychological and social consequences, and its impact on a person's quality of life can be better than that of any thyroid disorder. Patients with epilepsy are prone to have poorer self-esteem, higher level of anxiety and depression. They are more likely to be underemployed or employed, with lower rates of marriage and greater social isolation. Astonishingly, though we have developed too much, but still in many parts of the world, epilepsy is a contagious disease or possession by devils or any ancestral spirits. An Indian study reported that 15% of the respondents believe that epilepsy to be insanity. 40% believe that the child of epilepsy should not go to the school or their children should not play with them. And 66% objected in their children marrying someone who had epilepsy. Though we have progressed, still this stigma applies to epilepsy even till to date. A number of factors actually contribute to poor quality of life, including the unpredictable nature of the seizure attacks, as well as the stigma that we are talking about that are associated with epilepsy. Importantly, if we look into, and the research suggesting to anxiety and socially avoidant behavior. The impact of epilepsy with far-reaching and lifelong consequences. There is now growing recognition that when assessing the impact of epilepsy, patients and the physician should look beyond the seizure control. That we commonly ask actually to a patient, how is seizures your control? Of course, but at the same time, how is the life, how he is doing both in the social field, both in his work field and the family. That is also much more important have much more consequences. To address few of the key areas in quality, the children that are living with epilepsy many of the times receives inadequate schooling. Children of average intelligence or maybe a little average, above average intelligence who are living with epilepsy had at least a 2-year deficit in reading skills. This significantly lower educational performance could be attributed to cognitive impairment caused by the epilepsy itself, as well as the medications, that is the anti-epileptic drugs that they are taking. This cognitive impairment in children with epilepsy can take various forms. They most commonly come with a memory impairments, but sometimes they come with a slow mentations, that is difficulty in understanding things and difficulty in recall things, and sometimes with attention deficits. So with these children suffers regarding their educations. Another aspect is their employment. Unemployment levels are disproportionately higher for people with epilepsy. Approximately 2 to 3 times greater than that of the general population. And it is also higher than that of the population, than that of the common populations who are living with other disabilities. People with epilepsy are more likely to experience problem in identifying a job sometimes than that of the general populations. These combinations of institutional and social restrictions that are imposed upon them often results in people with epilepsy underperforming compared to those of the general population in the workplace. Another important area that these people with epilepsy are independence. As we have seen, many people with epilepsy experience problems with physical disability, which may limit their independence. But at the same time, even without any physical disability, the fear of having a seizure and the cognitive consequences of epilepsy and treatment, and sometimes the ineffective treatments also hinder their independence. An inability to obtain a driving license due to the seizure adds to limitations and restrictions experienced by people with epilepsy throughout their life. All these things lead to basically a social isolation, which is one of the major problems and major hindrance actually in these patients. Many people with epilepsy hide their conditions from others, which can result in social isolations and reduced self-esteem, and can lead to a feeling of helplessness and depressions consequently. Together with social stigma that persists in some parts of the society, people with epilepsy often feel a sense of social isolation and have an overall reduced quality of life. Social isolation and quality of life have also been shown to be significantly compromised in people who cares for the epileptic patients, that is, for the caregivers also. So this impact the quality of the life not only in the patients or the subjects with the epilepsy, but also their family members, that is the caregivers of those patients with epilepsy. Now, how to overcome this? No doubt, as we are looking to control the seizure, as we are looking to have their life without any seizure attack, we have to look a little beyond of these things so that these people with epilepsy can live a good life with a good quality, with a good social, physical, and as well as good family life. The important and the paramount factors here is there should have no doubt a good control of the seizure. And this, if possible, should be achieved with monotherapy, means with a single anti-epileptic drugs. Because as the number of the drugs are increases to control the seizures, similarly, the number of the side effects also crop up, which may consequently impair their quality of life. At the same time, not only the seizure control, but at the same time, we have to address the other issues that are associated, like marriage, like their educations, their driving, their other activities regarding sports and everything. In this regard, maybe a counseling can help in a form of a clinical counseling that could help to tide over the situations. At the same time, we should have to raise the awareness in the society regarding the epilepsy treatment, its effectiveness, and we must have a public awareness and educational campaigns which should be instituted and which might be more helpful to overcome these all stigmas and to give them a reasonable and a better and to near normal quality of life. So, quality of life in people with epilepsy is compromised because of stigmas, because of sometimes their unemployment, because of their educational abilities, and at the same time, many of the times because of the medication itself. So we have to look in a holistic way to treat the seizure patients, not only to control the seizures, at the same time looking beyond this to offer them a good quality of life by means of a good clinical counseling and good public awareness. Thank you.